ahead and get started, and happy if people trickle in. And for those of you who didn't see the refreshments right around the corner, feel free to go ahead and grab anything you want now or later. Thank you guys so much for coming this morning. I want to introduce myself. My name's Amanda Ryder, and I'm one of the coordinators for Metro West Moves. And I want to thank you again for being here. I know early meeting on a Monday morning isn't the most convenient time to come, but we really appreciate everybody being here. And for those of you who aren't familiar with Metro West Moves, we're a tri-community mass in motion initiative, which includes the communities of Framingham, Hudson, and Marlborough, and it's part of the Middlesex County Community Transformation Grants. And what we do is we really aim to improve healthy eating and active, smoke-free living in the 3 communities as well as the larger Metro West region. So I think we have a very exciting agenda for you all this morning with some great presenters who I'm really pleased could be here. I do see a number of familiar faces, so I'm not going to spend too much time on my piece, but I did just want to lead off with a brief overview of Metro West Moves and what we do, and then we can move on to the feature presentations. So as you can see on the board, the mission of Metro West Moves is to facilitate opportunities for Metro West residents to engage in healthy and active, healthy eating and active smoke-free living. And I would add, particularly for this crowd, as well as residents, this is applicable to employees as well. And the vision that we have for Metro West Moves is that the communities of Framingham, Hudson, and Marlborough will be measurably transformed so that healthy eating and active smoke-free living will be the way of life for all residents as well as employees. So as you, I know a lot of people here might be familiar, might work in the health and wellness sectors and are likely familiar with a lot of this information, but I would be remiss if I didn't go over the benefits of a healthy lifestyle, which have been shown to lower the risk of a number of diseases that you see up on the board. This slide highlights the extent of the obesity epidemic across the nation, and in Massachusetts, 23% of adults are obese, and while the country as a whole has made significant strides to reduce tobacco use, 18% of Massachusetts residents still are current smokers. So, as you can see, we've still got a lot of work to do. So chronic disease and the associated health risk behaviors have also led to a decrease in productivity at the worksite, which might be why a number of you are here today, and this has also led to unsustainable healthcare costs. In 2009, total hospital charges in Massachusetts approached $6.8 billion for chronic diseases, and that's over $1,000 for every man, woman, and child in the state, and this only counts hospitalizations. So public health practitioners, along with others, are increasingly realizing that an individual level approach isn't going to solve all of the health challenges that we face today. To be most effective, we need to target not only the individual, but also their family and peers, the places they work, and the communities in which they live, as well as policies and systems to really improve health. This social ecological framework guides the way Metro West Moves does our work. We really aim to affect kind of these 3 more outer layers of the model, because we believe that these types of changes will have the longest lasting effects and be most sustainable. Just a little bit more background. Metro West Moves, as I mentioned, is a mass in motion initiative that was funded through community transformation grants through the Centers for Disease Control and Prevention. Mass in motion initiatives are currently happening in 52 communities, representing 33% of the state's population. And a number of you might be familiar with Metro West Moves, but I wanted to just put this into context to show that what Metro West Moves is doing is really part of a larger statewide initiative to improve the health of Massachusetts communities. Now, from the grant application stage, it was evident that public health alone couldn't solve couldn't do all of this work. To really affect community level change required the inclusion of a broad group of stakeholders. To that end, we have engaged a really diverse steering committee. And as you can see here, we have a number of municipal staff from each of the 3 communities that participate on our steering committee. And it's really been invaluable to have the participation of these diverse stakeholders, as each department can bring a unique perspective to the table. But we know that to really affect community change, Metro West Moves has to step beyond the municipal setting and create sustainable community partnerships. Our current partners range from the Boys and Girls Clubs to the Metro West YMCA, and I saw Lisa come in from the Y, and ranges to also the restaurants that participate in our Healthy Dining Initiative, to healthcare organizations like the Edward M. Kennedy Health Center, and we see one of our roles as Metro West Moves as being a community convener and really working to promote and support the good work of our partners. And so we're really excited to have you all here today as we jumpstart our Worksite wellness efforts, which you'll soon